this is Dr. Wells with Wells Medicine. And a question that we get somewhat frequently is, do we see adolescent patients? This is a somewhat tricky question. Most of the studies on ketamine, stellate ganglion, TMS, nitrous oxide have been done with a typical study population. So that's patients between the ages of 18 and sometimes as low as 45, but generally 18 to 60 is your typical study patient population. So those are similarly the typical patients that we anticipate seeing at Wells Medicine. That's not to say that adolescents and older patients don't respond to these treatments, but they're not typically studied. So it's a little harder to make the case that the treatments are safe and efficacious for patients outside the age ranges of our study patients. We have had patients outside of our typical age ranges. So without question, we see patients from 18 to 70. For our younger patient population, we have had patients as young as 12. But generally under 18, we really like to make sure that we're on board with their psychiatrist, their pediatrician. We really like to make sure that we're getting referrals, that we're getting a good open line of communication back and forth. Again, we have had patients as young as 12, but I like to make sure they've tried a lot of other things because ketamine is a serious medication. Stellate ganglions are a serious treatment. And certainly something like a Prozac a day, if that was working, would be an easier, more typical treatment as a first-line therapy. Now, if the patients by age 12, 13, 14 have tried a lot of things, have been hospitalized, have been in therapy, have, done the typical treatments and just nothing is really working for them, then I'm happy to talk with their psychiatrist, their parents, their pediatrician, and make sure that this is an appropriate treatment for them. And we have had very good success with our older teens and our younger adolescents as well. Certainly, it appears that anyone over the age of about 14 or 15 reacts quite well to ketamine treatments, pretty much typically as we would expect someone at 18 to react. Sometimes the younger patients don't really like having an IV, or they're not quite as prepared for the kind of emotional state that ketamine can bring up because it's a very intense experience. And we do see a lot of social and emotional issues in those kids, the 12 to 15-year-old age range, where there's a lot more school issues. There's a lot more familial issues and relational issues that need to be very heavily addressed as well as the ketamine treatment. Above the age of 70, we generally like to make sure that there aren't any underlying severe health conditions. We like to make sure that there's no underlying dementia, that the patient is being followed and treated for any high blood pressure, heart disease, stroke risk. Not because ketamine can cause any of those, but because we certainly don't want to exacerbate anything with our treatments. And we want to make sure that patients are being evaluated to make sure that any underlying dementia is being treated rather than assuming that it's depression and missing something that could be treated early on. So there's a lot of other things going on in that population, whether it's the younger or the older population. And so we do kind of hold those out separately to get referrals or to get clearances from their other providers. But we're certainly open to treating those patients. And again, our youngest was 12 and our oldest was 92. So we're happy to do whatever we can to take care of patients as much as possible.